A cesarean delivery, commonly known as a C-section, is a surgical procedure used to deliver a baby. Unlike a natural vaginal birth, the baby is delivered through an incision made in the mother's abdomen and uterus. In the United States, about 1 in 3 babies are born this way. While some C-sections are planned, others occur during emergencies when complications arise during delivery. When is a C-section needed? There are various reasons why a C-section might be necessary. Some common causes include maternal health conditions, carrying multiple babies, the baby being too large, or the baby being in the wrong position. Other reasons include problems with the placenta, or if labor isn't progressing properly. It's important to consult your healthcare provider about the best delivery method for your situation. Planning versus emergency C-sections. C-sections can either be planned or done as an emergency. Planned C-sections usually happen when the doctor identifies a condition early in pregnancy. On the other hand, emergency C-sections occur when unforeseen complications arise during labor, such as the baby's distress or labor stalling. Both types are aimed at ensuring the safety of the mother and the baby. How is a C-section performed? Before the procedure, anesthesia is administered. Most commonly, this is an epidural or spinal block, which numbs the lower part of the body. In some cases, general anesthesia is used, especially during emergencies. During surgery, the surgeon makes an incision in the abdomen and uterus to safely remove the baby, followed by cutting the umbilical cord and delivering the placenta. Recovery. After a C-section. Recovering from a C-section takes longer than from a vaginal birth, as it is a major surgery. New mothers may experience pain at the incision site, limited mobility, and fatigue. It's crucial to follow the doctor's instructions, rest as much as possible, and avoid heavy lifting for several weeks to allow the body to heal. Risks of a C-section. Although a C-section is a generally safe procedure, it carries risks. These include infection, blood clots, excessive blood loss, and injury to nearby organs like the bladder or bowel. There's also the possibility of complications from anesthesia. Additionally, having a C-section increases the risk of complications in future pregnancies. C-section versus vaginal birth. Compared to vaginal birth, C-sections involve a longer recovery period and higher chances of complications. However, sometimes they are the safest option for both mother and baby. Mothers who have had a C-section may be able to try a vaginal birth after cesarean, VBAC, in future pregnancies, depending on the circumstances. Impact on future pregnancies. Multiple C-sections can increase the likelihood of complications, such as placenta previa, placenta accreta, or uterine rupture in future pregnancies. The more C-sections a woman has, the greater these risks become, making it essential to discuss future delivery plans with your healthcare provider. Emotional and mental aspects. The emotional impact of a C-section can vary. Some mothers feel disappointment if they were hoping for a natural birth, while others may feel relief if the surgery was necessary for the baby's safety. It's important to talk about any feelings or concerns with your doctor or a counselor to process the experience and plan for future deliveries. A C-section is a common and often necessary procedure to ensure the health of both mother and baby. While it is a major surgery with its own risks and recovery process, understanding when and why it's needed can help expectant mothers feel more prepared. Always consult with your healthcare provider to determine the safest delivery method for your unique situation. As with any medical procedure, preparation and education are key to a smooth delivery. If you or someone you know is expecting a baby and has questions about cesarean delivery, encourage them to talk to their healthcare team. Being informed allows mothers to make the best choices for themselves and their babies, ensuring a safer and more confident birthing experience.